6:48, welcome back to 3 News. Well, next month, a Northeast Ohio effort returns to tackle a serious health disparity. Black Family Cancer Awareness Week was created to raise awareness about the disproportionate impact cancer has on Black families. And joining me this morning is Director of Community Engagement at the Case Comprehensive Cancer Center, Kristina Austin. So, Chris, thank you so much for being here. And as we know, I am the honorary chair once again for Black Family Cancer Awareness Week. And I know I touched on it a little in the intro, but some people may say, well, why do we need a specific week or specific event targeted towards African Americans? Why not just every cancer awareness?
Sure, and thanks for that question. And while anyone is welcome to come to our Black Family Cancer Awareness event on June 13th, we do specifically focus on Black or African American communities because there are such high disparities as it relates to cancer and actually around health in general. But when we look at cancer and Black or African American families, we see that there are higher rates of cancer and then also higher mortality, which means that they die more often from cancer than other races, nationalities. And so we want to make sure that we are providing opportunities to educate individuals about the importance of screening, about prevention, and what are some of the risk factors that they can address. So that's why we're inviting everybody to come out.
Yeah, in all transparency, early screening is actually what saved my life. I am a gospel proponent and preaching the gospel of early screenings because, you know, my first mammogram, 40 years old, and I was diagnosed with breast cancer, but we caught it so early that the treatment was pretty good. And I love to have these type of events to say, hey, these screenings are so important, but why do you think people are really scared to get those screenings? In my advocacy work, that's what I'm finding, like, oh, I don't want to know, you know, or I don't want to get those testings. How can you really overcome that?
You know, that's a great question. I think it's constantly talking about it. So your advocacy is very important, being able to have an opportunity to come on and talk about BlackFamCan so that people know, hey, you can come out, you can talk to people, you can get these screenings done. But I think people are afraid for a number of different reasons. For one, it's scary. It's scary to think about that I could have a cancer diagnosis. So for some, they are, well, if I don't know, then I don't have to do anything about it. For others, it's the thought of, if I get a screening and I have cancer, I can't take off of work, maybe I'm underinsured, who's going to take care of my family? So there's so many different factors. And we also know that there's some mistrust in the community of healthcare institutions, and there's been a long history where we look at research and discrimination, and so it's important for people to understand that we are working to address that, and so we want to make sure that people are coming out to get these screenings.
We have about 15 seconds left. I do want to talk about what is going on there at Black Family Cancer Awareness Week or BlackFamCan, as we put the information up on the screen. Can you just give us a highlight of all of the events you have going on that day?
People can come and get a mammogram. We're doing prostate cancer screenings. People can come in for STI screenings. We are doing blood pressure checks. People can come in for A1C to look at diabetes. And then we also have healthcare professionals and mental health professionals there to talk with people and answer questions.
Wonderful. 11 a.m. to 3 p.m. at the Warren E. Anderson Midtown Collaboration Center. That's new. That's a different place, right?
No, it's the same place.
It is?
They just added yeah.
Okay, wonderful. Thank you so much for being here. And I cannot wait. I am going to MC one of the events that you have going on that day. And we will be right back after the break.